welcome to another edition of the Policy Corner, Quarantine Edition. Apologies that we're a little behind on updating you on what went down and what's coming up, but frankly, we're a little tired from our many special sessions, and we had a holiday. So here's what went down in the last special session and what's coming up.
All had a big impact during the special session. Legislative leadership heard your call to use a significant portion of the rainy day fund to plug gaps in the budget, and they did exactly that, using over $650 million. As a result, critical social and human service programs, along with public education, were pretty much protected. For example, the $450,000 to get the limited service waiver off the ground is still in place, as is all of the funding for folks who are currently receiving services. So great job. There were a couple things that fell by the wayside during the special session that we're going to have to come back in January again for. Among those is the additional money for affordable housing, for example. Also, unfortunately, it doesn't look like we're quite done yet. They are talking about coming back for another special session in August. As soon as we know what that looks like, we will let you know.
Yeah, so as far as legislation during the special session, there's really only one piece that we were kind of involved in. That was SB 5011. It was high-risk population protection amendments. The bill, according to the sponsor, Senator Bramble, was aimed at the fact that many facilities, long-term care facilities, were refusing to do testing of residents. And so the goal is to enable the Department of Health and the state to be able to do testing in long-term care facilities. Unfortunately, from our perspective, the bill really puts most of the burden of getting tested on residents and not on facilities, because it says that if a resident refuses a test, which they wanted to protect the individual's right to refuse a test, but unfortunately that says that now individuals can be discharged if they refuse that test. Given our work in long-term care over the last several years, we've seen discharges used improperly, and people being forced out of their facility for unlawful reasons under federal regulations, and we have seen reports in other states of discharges being used during the pandemic to force people out. So we had concerns that this was kind of problematic under federal regulations. Given if a person is to be discharged, they should be sent to a place that can better meet their needs, and there has to be a plan, and they have to be given notice. And it's not clear how any of that, if done, is really going to work with this new state law. We passed our concerns to the legislature. Unfortunately, they passed this bill, and then after that, we did pass our concerns to the governor. But unfortunately, he also signed the bill this week. So we'll keep an eye on long-term care facilities, as we have been during the pandemic, and how these discharges will impact folks.
So, as I'm sure you all can tell, we are extremely excited about the prospect of another special session coming up in August. We will keep you posted on what the agenda for that looks like as soon as we know. In the meantime, we also know that many of you are wondering what the reopening of schools will look like. Between now and then, we will keep you posted as we learn more about that, as well as post information about additional resources or options that you may have as we go forward.
As always, thanks for watching. Now you know what went down and what is in fact coming up.
Until we meet again, stay home, stay safe, stay healthy, and don't forget to wear your mask.